Forest Animal Rescue is finishing their state-of-the-art sanctuary on 80 acres in the Ocala National Forest. The last phase of construction is the on-site clinic to help with bear cub rehabilitation and release. Forest Animal Rescue is a 501c3. Your contribution is entirely tax-deductible. Visit forestanimalrescue.org.
All right, 20 minutes before 12 o'clock. Gosh, the morning has gone fast, huh? We've got some great opportunities in our community for young people wanting to get into the medical profession to learn a variety of things that you wouldn't. I mean, for a small town, we've got like 6 universities, I think, that are represented. They have campuses here, and I know that with the retirement population, we've got a lot of facilities like assisted living and skilled nursing, and I don't even know all the actual titles. Plus, we've got 2 really amazing hospitals. Lots of opportunities for work to become a nurse. I have a nephew who's a nurse. He's one of those male nurses that for a while, it took me a while to get used to the whole idea of a male nurse. Yeah. But when I had a little tiny thing on my nose, knock on wood that I don't have it again, it was skin cancer, a little something. What was it called again? Basil. And the doctor, who was really, really good, did everything. But what he wasn't that good at was talking to me. And everything I understand about what I went through was information I got from the nurses. They all were really good. In fact, the thing I'm going through right now with my leg, it's all the nurses who explain everything to me. Dr. John Danaher is on the phone. He's going to talk to us about the growing need for nursing professionals. Dr. Danaher is a healthcare expert and the president of education for nursing and health professionals at Elsevier. Am I saying that right, Robin? We'll find out right now. Doctor, good morning, sir. How are you?
Good morning. Good morning, Larry. Good morning, Robin. I'm delighted to be with you today.
And thank you for doing that. Where are you calling from?
I'm calling from Chicago.
Chicago.
Nice.
All right. Chicago is my kind of town, right?
I love Chicago.
Gosh, I got a little reverb going on here. So tell me about nursing professionals. You're talking to an area right now, this part of the state, where we do have a lot of. It's a mixed area. We've got the college kids because of the university, and we've got a lot of retirees here. So the two go together, especially if you're a college kid, studying medicine and wanting to be a nurse.
Yeah. No, Larry, Robin, and your audience, the issue in the profession of nursing couldn't be more exciting. What's happening is that we're currently not educating enough nurses to meet the demand.
Yeah, that's what I heard.
So what's happening is the demand for nurses every year is going up about 3%, and the schools aren't just producing enough graduates to fulfill that need.
Oh my gosh! So there's an opportunity right there if you're looking for a career decision, right?
It absolutely is, and Larry, just to share some figures with you, the median salary for a nurse is $66,000. The best paid nurses at the bachelor's level, they make up to $100,000. And when you get into some of the specialized areas, such as nurse anesthetists, nurse midwives, nurse practitioners, they can make up to $153,000 a year. So you can see it's a wonderful profession with a strong demand and very well paid.
Very good. And is there a way to kind of check out the landscape of opportunities? In other words, is there like a website where I would go to, say, if I get my nursing degree, where would I most likely find work?
Yes. What we do, and a lot of what we encourage high school students to do, college graduates to do, and also career changers, teachers and other professions, paramedics, is really first and foremost go to the local resources. And so in Ocala, what you want to do is you want to identify those community colleges, those state universities, and those public universities that have nursing programs and offer these career paths.
We had a local lady who was running for the county commission. She did not win the election, but when she came in here, she's also a nurse, and I was amazed at what she said. I just came out of surgery in order to come here to do the interview. I said, oh my gosh! So she's in there literally holding somebody's heart while the doctor was doing what he had to do.
Yes.
The heart was beating in her hand. Can you imagine that? Mm-hmm. It's just amazing what nurses do. We don't even understand all that they do. And I know that's probably not got anything to do with finding work as a nurse, but I don't know. It's more than about the salary. I think it's about the contribution to the community.
Well, Larry, you could not be more correct. And whenever national polls go out as to who the most respected individuals in our society are, nurses year in and year out come out at the very top. And you were talking earlier in the interview about the scope of practice and the things that nurses do that is different, for example, than what physicians do. And you couldn't have been more correct. It's much more holistic. They're much more concerned about the entirety of the patient rather than just the diagnosis and the treatment.
And I'm glad that you brought up midwives, because they seem to be the ones now that people are going to for delivering their baby, but the OBGYN is still there just in case something happens.
Robin, what you're talking about couldn't be more important. And what we are seeing with the Affordable Care Act and with other changes in the healthcare delivery system, we're seeing what are called interdisciplinary care teams, and the front line and often the first person who the patient is dealing with is the nurse practitioner or the nurse. And as you've said, the traditional order is being changed, and so it's less the medical doctor you interact with and more the nurse or the nurse practitioner.
So who do we want to direct in this interview? Do we want to direct the people who want to start out on a career, like a high school student maybe, or do we want to talk to the ladies and gentlemen, I know it's not just all ladies, who have already achieved their degree and they're looking for work, or both?
Well, Larry, it's a great question, and it's both. There's few professions that scaffold more than the field of nursing. And what I mean by scaffold is that a lot of nurses come in, and they may come in at the entry level. They'll be diploma level nurses, and they'll be what we refer to as either vocational nurses or practical nurses. And that can be an 18-month diploma. And after they do that job for a few years, they may decide then to scaffold up to the next level and be an associate degree nurse. And then you can keep on going to the bachelor's level, to the master's level, and then to the doctorate level, and a doctor of nurse practice, etc. So who we're trying to target here is both those new students that are coming in at the high school level or at the college level, but also those encouraging those people already in the profession to go on and get an additional degree so that they can have a broader scope of practice.
What is Elsevier? What is that a college?
So no. So what Elsevier is, we're an international company, and we're what you call an information solutions provider to the healthcare profession, to science and technology. So when I use the word information solutions provider, what I'm talking about are books, journals, digital products, digital databases, and so we support student success, and we make clinicians better healthcare providers.
And are you able to help the person that is in the nursing field, like give them direction as to what you feel the good hospitals are and good medical centers are? Because some, are not so good in the ratings.
Yes, yeah. We are very active in both on the educational side and then also on the hospital side. And Robin, what we're doing and we're actively involved with is helping to identify those hospitals that have the best outcomes and provide the best care. And so that's very much a focus for us, and helping ensuring that our students that we support, go on and become successful employees in high quality hospitals is very much a focus for us.
Yeah, I know that we have a lot of people who are probably tuning in and wanting to take advantage of this. So we've got less than a minute left. Should we send them to a website? What should we do?
Yeah, I think again, there's no specific website, Larry, that will answer all their questions. There's there's a couple of places. I would start at both the community colleges and the state universities in the Ocala area.
Okay.
So I would start by finding out what nursing programs that they have there. And then also they can reach out to the hospitals and find out, talking with their human resources department, et cetera, where are they hiring graduates from? What schools are they deem as high quality graduates?
And elsevier.com, is that a good website to direct them as we close out? We got 10 seconds.
It certainly is.
Okay.
It certainly is.
All right. Doctor, thank you so much for being on the air today. We'll put this interview up on YouTube and Facebook, and we'll include the link. Thank you, sir. We'll be right back.
Catholic Charity last night, also raising some eyebrows as Donald Trump and Hillary Clinton took shots at each other.
Here she is tonight in public, pretending not to hate Catholics.
And she returned the favor.
Donald looks at the Statue of Liberty and sees a 4. Maybe a 5 if she loses the torch and tablet.
It's expected to be the last time the two share a stage before the election.
Fox Radio's Tanya J. Powers. The Samsung smartphone grounded from flying in the U.S., now also told to stay off the rails.
Amtrak is banning Samsung Galaxy Note 7 smartphones from its trains, stations, platforms, and buses. According to Amtrak, attendants will randomly check passengers to see if they have the banned smartphones.
Vicki Nguyen with Fox 11 Santa Barbara, California. Fox News, we report, you decide.
If you've heard of WeatherTech floor liners, you probably know that for your vehicle's floor, nothing protects better. But what about protection for the rest of your car or truck? I'm David McNeil.